Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin momentarily. We will take questions submitted by members of the media after making brief remarks. I'll now turn it over to Dr. Alex Garza.
Okay, good afternoon, and thank you everybody for tuning in for today's briefing. Today we're going to discuss our normal issues like vaccine and hospital admissions and so forth. But first I wanted to recognize something that had occurred this week, and that is the anniversary of the first press briefing that we had with the Pandemic Task Force. It was on April 5th of last year when the task force held its first press conference at St. Louis University High School. Now, it's very odd to think back to where we were a year ago. Even the atmosphere then was standing in the gym without masks on, and the most pressing question of the day was about how we were going to get more personal protective equipment. So certainly a lot of things have changed over the past now 367 days. And I'm not going to go into a deep dive in events that have occurred through over the past year, and we'll have plenty of time to do that in the future. But I did want to acknowledge all of the hard work and the camaraderie from my fellow task force members over the course of the past year. It's certainly been an interesting year. Secondly, I also wanted to talk a little bit more about recent developments with the COVID-19 variants, which are, as most people know, are mutations or versions of the coronavirus. So yesterday, the Missouri Department of Health and Senior Services reported the first identified case of the COVID variant B.1.351, which, as you know, is the South African variant. But you'll also remember that another variant, the B.1.1.7, also known as the UK variant, was first detected in Missouri back in February. Now, we've suspected for some time that these variants were present and spreading in our region, and now we know that they are spreading around the country. And while there's still a lot we have to learn about these variants, it appears that they spread more easily than the coronavirus we have been fighting most of the year. And we also know that the 3 available vaccines offer good protection against the variants, especially against severe illness and death. So the confirmation of these variants within our region underscore the need to vaccinate the community as quickly as we can and do everything that we can to continue to cease or to decrease the spread of the current COVID coronavirus. By immunizing the population and preventing spread, we can prevent these more contagious variants from sickening and killing people within our region. So with that in mind, let's turn to an update on vaccinations within our region. So to date, vaccinators in our region are reporting administered 945,911 total doses of COVID vaccines. And so that includes 603,000 first doses and a little bit over 360,000 second doses. Now, these numbers are a little bit conservative because we know that there are some issues of getting data into the state database. So we believe that there are more vaccinations that have occurred that aren't included in these numbers, but at least this is a rough approximation of the number of vaccinations that have occurred within Region C. Now, there's many mass vaccination events occurring throughout the region as well. And so as we mentioned last week, the city of St. Louis is hosting an 8-week FEMA vaccination event down at the Dome. Starting today, as many as 3,000 people a day can get vaccinated at the Dome at America Center. And starting on Friday, every Missourian over the age of 16 will be eligible to get the vaccine as well. So if you've been waiting to sign up and find an appointment, now is the time to do so. And if you can, help your family and friends, particularly those that don't have access to the internet or might not have the skills to navigate websites, things like that. Help them get signed up too. And if you can, provide transportation as long as you're doing all of the mitigation strategies to help people get vaccinated as well. So to sign up for the mass vaccination events, you'll need to register at the state's vaccine navigator, and that's at covidvaccine.mo.gov. So covidvaccine.mo.gov. Or call the COVID vaccine hotline, and that number is 877-435 8411. Now, once you register with the Vaccine Navigator, you'll receive a link by email or text to select an appointment time. In addition to the event at the America Center, there are also many other upcoming events in the St. Louis region, including St. Louis County, St. Charles, Jefferson County, St. Francis County, and so forth. And again, the details for the mass events and the links can be found at covidvaccine.mo.gov. And if you need assistance, call the vaccine hotline, 877-435-8411. So that's all good news that we're getting more and more vaccine into the region. Now let's talk a little bit about our hospital data. And so today we're reporting a daily admissions number of 48, which is a little bit up from where we were a couple of days ago. And as we've said over the last couple of weeks, we've seen this plateau in the number where we've been sort of jogging up and down. That 7-day admission now is around 37, and it's been stuck around there for a couple of weeks now. As far as hospitalizations are concerned, today we're reporting 240 COVID patients hospitalized in the task force hospitals. And the moving average is now 213 patients. And again, this number has plateaued as well, and it hasn't really moved much in either direction, but hopefully getting more vaccine on board with our population and continuing our mitigation strategies, we can get our number down. A little bit more detail about our COVID numbers. As we reported, 240 people hospitalized. We have 49 patients that are COVID positive in our intensive care units, and we have 34 confirmed COVID patients on ventilators today. Looking at our suspected COVID patients, we have 39 patients hospitalized today with suspected COVID. We have 6 suspected COVID patients in our intensive care units, and we have 3 suspected COVID patients on ventilators today. Our good news slide, our discharges. We discharged 48 COVID patients yesterday from our task force hospitals, and that brings our cumulative total to 20,770 patients discharged home. And again, a big thank you to all of our healthcare providers and everybody that supports them to get these patients well enough to go home to their family and friends. Unfortunately, we're still seeing some deaths from COVID as well, and so today we're reporting 4 COVID deaths yesterday from our task force hospitals. And that brings our 7-day moving average to 3 deaths per day. Now moving on from our hospital data to our modeling data. So this is our model that we ran last week. Again, we run them on every Thursday. We did adjust the model slightly last week because of that plateauing that we've seen. And so essentially what that does is it draws it further out in time. And so you can see the difference between that light blue line and the gold colored line, and the difference in the slope and how much further out now we predict that the pandemic is going to occur because we continue to have transmission, continue to have admissions and hospitalizations. A little bit about the epi curves from around the region. We have seen either that plateauing or an uptick in cases from around the region, and so that's consistent with the rest of our data not showing any dramatic decreases in our hospitalization data or some of our other data. Going through our scorecard, so this is good news. We're in the green area for both of these metrics, which are occupancy metrics, both in total, which is down to around 5% of total beds with COVID patients, and our intensive care unit is around a little bit over 8% of COVID patients occupying ICU beds. So both in the green area, which is all good news. Our new admissions, as I mentioned, 37. You can see that we're just below that red line of 40. We would like to see that continue to come down, but right now we seem to be stuck right around that number. Our prevalence of reported cases, again, these graphs all look fairly similar. We're sitting around 2, and we really haven't moved off that mark, or if at worst increased a little bit of our prevalence of reported cases. And remember, this is a summing of the past 14 days, and so unless there's a decrease in any of those 14 days, it's going to stay the same. And then our weekly change of reported cases, as you can see here, is at 5.5%. Again, it's comparing the most immediate 14 days to the previous 14 days. So you have to have that steady decline in the most recent 14 days for this number to come down. And so obviously that hasn't been occurring. Our testing has come up to just under 10%. We would really like it to stay below 10%. It's a little bit tough to interpret what this data actually means because we know that our testing numbers in whole have come down as well, and so those positives are going to have a greater impact on the percentage. But nonetheless, this number really does need to come down in order for us to feel like we're moving in the right direction as far as the pandemic is concerned. And then our reproductive number again is above 1, which is consistent with all of the other data that I've just shown you, whether it's cases or percent positive or prevalence of disease, admissions and hospital census. So the virus is still continuing to infect people in the St. Louis metropolitan area. Percentage of them are becoming sick enough to be admitted to the hospital. Some of them are coming into our intensive care unit, and of course some of them are passing away as well from COVID. So we're not out of this yet. That's why we need to continue doing all of our mitigation strategies, as well as get as many people vaccinated as we possibly can so we can drive all of those metrics down. So we're very happy for the gains that we've attained over the past couple of months, but we really need to double down on these efforts now to get us down to even lower levels so we can all go back to what we want, which is more opening of our communities and being able to do those things that we love to do. And so that concludes our updates for today, and with that we'll take some questions from the media.
Some vaccinators are not requiring invitations anymore, and some are allowing walk-ins. Is it becoming more difficult to fill vaccine appointments? And if so, why do you think that is?
I'll just tell you the messages that we've heard from our different healthcare systems and from public health is that it is taking more effort to fill those slots. And so, for instance, if we have 100 slots for vaccine, previously we could fill those up with 110 invitations. I'm just making this stuff up. Whereas now it's taking us 200 or 300 invitations in order to fill that same 100 slots. And that's because people are going out and getting vaccinated by different means, which is a good thing. So it is taking more effort to fill those vaccination slots. They are still filling up. It's just taking a little bit more time and a little bit more invitations to get them filled. And that's because of just what I said. People are finding ways to go out and get vaccinated, whether that's traveling outside of the metropolitan area or signing up for multiple different vaccination sites. So it's really to be expected as time goes on that you're going to have a harder and harder time of filling those schedules.
Does it seem the current vaccination methods are the most efficient to get the vaccine equitably distributed through the region? Is the St. Louis region as a whole doing all it can to get vaccine to those who want it?
Yeah, it's a yes and no sort of answer. So we're still filling up all of our clinics with appointments for a vaccine. We'll have to see how that mass vax event plays out in the city, and whether they can get enough people to come down to fill all of those slots. Our partners in public health are also working on more mobile teams to get out into the community. So I think you're going to see more and more of a distributed model for vaccines. So whether that's to your local pharmacy or to pop-up clinics or going out into certain communities, particularly vulnerable communities, all of those different avenues I think are going to become more and more available as time goes on. So I don't think that we're at that spot where we feel that we have the optimal distribution strategy right now, but we're getting to it with more vaccine becoming available, and that should impact the amount of people getting vaccinated and increase the immunity in the population and get us closer to where we all want to be.
Do you think having walk-in vaccination clinics where an appointment is not required could improve access? Are there any plans by healthcare systems to offer such sites?
Yeah, I do think anything that you can do to make vaccination easier is going to improve your vaccination rate. So whether that is having walk-up clinics or open scheduling or things like that. So that is always going to improve the uptake in vaccine. So the challenge with that, and especially with the healthcare side, and that's because the healthcare side is dealing mostly with the Pfizer vaccine, which requires all of that ultra-cold refrigeration. And in order for us to plan our clinics effectively, so how much vaccine we need to thaw, draw up, how many people do we need to have on staff, all of those different things, because it takes time with walk-ins to do all the paperwork, get it registered, and then you want to make sure you're planning out all of the vaccine that you're going to be using as well. So if there was a clinic just purely dedicated to walk-in, it would make it much easier. But all of our, if not most of our clinics are for scheduled appointments. And so it makes it very difficult to do the walk-up because then you don't know how much vaccine you're going to need on any given day. So if we have a dedicated walk-in clinic, then that would be a little bit easier to operationalize. Secondly, if it's a little bit easier to do with like the J&J vaccine where it's single shot, the refrigeration requirements aren't quite as onerous, and so it's a little bit easier depending upon vaccine and the group that's giving vaccinations.
The CDC says vaccinations are going well, but COVID variants could spell trouble for younger people who have not yet been vaccinated. How concerned are you about that possibility, and has there been a rise in COVID infection and hospitalizations locally among younger people? Should we be doubling down on safety measures?
Well, I'll answer the second part first. Yes, we should be doubling down on safety measures. So anything that we can do to interrupt transmission, to get more people vaccinated, is going to get us faster to that immunity within the population. So yes, we still need to be doubling down on all of those issues. We have seen a decline in those cohorts of patients. So the older population is not getting sick, is not being admitted to the hospital in as high a numbers as we had seen previously. We are seeing more people, more from sort of that middle age category, that 40 to 65, some with healthcare problems, but certainly people that have had chronic conditions that have gotten vaccinated. We've seen a decrease in that population as well. So the concern with the variants, of course, is that it's more transmissible. And so we still have a significant percent of the population that is not vaccinated. And if we relax on our mitigation strategies too soon, you combine that with a more transmissible virus, and then that'll produce a result like you're seeing in some parts of the country where you see an uptick in cases. The good news is that we aren't seeing as many of the more vulnerable population becoming sick. But on the flip side of that, we are seeing that younger population, and these are cases that could largely be prevented if we're continuing to do mitigation strategies and everybody getting vaccinated as quickly as they can. So it's sort of a mixed bag.
That concludes our list of questions. Thanks for watching.